When endodontic treatment is properly performed, there is enormous potential for success. To maximize success, it is wise to appreciate root concavities, root curvatures, and root canal systems. Access cavities involve removing the pulpal roof. Once that's performed, we fill the pulp chamber brim full with the appropriate irrigant. Most canals exhibit enough space to accommodate a tin file. The instrument is fed into the canal and passively pushed apically as its handle is gently rocked back and forth. A 15-degree clockwise rotation is followed by a 15-degree counterclockwise rotation of the file handle. Repeating this motion pulls the file down and into the canal. The handle is rocked back and forth until it's just snug. When it's snug, we pull, and importantly, we're cutting on the outstroke, away from the terminus, and out of the canal. Generally, about 6 feeded-in pull cutting cycles achieves a smooth and reproducible glide path. When scouting the coronal two-thirds of a canal, clinicians need to be aware of the handle as it relates to the long axis of the canal. The next instrument in the series is the 15 file. Recall it's a 15 at D0 and a 47 at D16. This implies that this instrument can create more space than its numerical name would suggest. Feed it in until the handle is just snug, and when we pull, we're cutting importantly out of the canal, away from the terminus, and towards the greater cross-sectional diameters. Another 6 cutting cycles completes the work. After using the 10 and the 15 scouting files, a reproducible glide path exists in the coronal two-thirds of the root. This allows us to come in with our first Pro-Taper rotary shaping file. Shaper 1 is a 17 at D0 and has multiple tapers over its 14 millimeters of cutting blades. This instrument is carried passively into the canal and allowed to float down through the root. When light resistance is encountered, the instrument is withdrawn. Oftentimes we'll carry the instrument back in and recapitulate to refine, smooth, and increase the glide path. Clinicians need to recognize that the reason the handles of the hand files are off axis is because of the internal triangle of dentin. To remove this, the instrument of choice is Shaper X. It's a 19 at D0 and it has a 19% taper over the first 9 millimeters of its cutting blades. The hero part of this instrument is its middle 1/3. That's where we want to cut on the outstroke. Allow the instrument to float into the canal until passive resistance is met. Then lift up and begin to paint and carve and eliminate dentin on the outstroke. Once space is made laterally, allow the instrument to move in a little bit deeper, again until light resistance is met. Then cut on the outstroke to relocate the canal away from focal danger. Confine the instrument to about 2/3 of its cutting blades below the orifice. After using Shaper X, the coronal 2/3 of the root canal system will be optimally prepared. To fully appreciate the work of Shaper X, let's look at the before and after views. Shaper X has also generated an enormous amount of debris, so we should irrigate to remove this loose debris. A tin file is carried into the root, and we recapitulate to break up pockets of resistance. The tin file is moved in short amplitude strokes to move debris into solution. We then re-irrigate to flush out this debris from the root canal space. A tin file is then carefully measured. The rubber stop is torqued to simulate the curvature of the root. The pre-curved tin file is passed through the pre-enlarged canal, and its handle is reciprocated gently, moving it deeper into the canal. Patency is now established. The instrument is moved in and out gently and minutely until the instrument is free and loose. By taking the tin file 1 millimeter through the foramen, we've transitioned the foramen to at least a 12. Recall that the 15 file is 50% bigger at D0 than the 10. The pre-curved 15 file is inserted and gently worked to length. If necessary, we can use chelators to encourage the mechanical objectives. When the 15 file is at the anticipated length, we can confirm working length with either a radiograph or using the electronic apex locator. Now we need to verify the glide path. To accomplish this, the 15 file is picked up 1 millimeter and gently moved to length. Now it's picked up 2 millimeters and pushed to length. In general, if we can move the 15 file over a range of 3 to 5 millimeters, we have a reproducible glide path for rotary instruments to follow. Shaper number 1 is 17 at D0 and can easily follow this glide path. Allow it to float down through the root. If any resistance is encountered, remove the instrument, re-irrigate, recapitulate, and then re-irrigate. This will allow the instrument to achieve length. When you reach length, remove the instrument immediately because the shape has already been cut. There is no need to pump the instrument or rotate at length. Following the use of Shaper 1, we should re-irrigate and recapitulate. Be sure to carry the tin file to the terminus and then confirm patency. Work the instrument up and down in short amplitude strokes to move debris into solution and then re-irrigate. The next instrument in the series is Shaper 2 and follows the use of Shaper 1. It's a 19 at D0 and has progressive tapers over its 14 millimeters of cutting blades. The instrument is carried into the canal and allowed to float through the root canal space. Generally, it can achieve length on the first pass. When the instrument arrives at length, immediately withdraw the instrument as the shape has been cut. Following its use, we need to irrigate and recapitulate and re-irrigate. Following the use of our first two shapers to length, it is wise to recall that working length will decrease as we've created a more direct path to the radiographic terminus. It would be wise then to reconfirm working length prior to finishing the root canal space. Our first finishing instrument is Finisher 1. It's a 20 at D0 and has a 7% taper. This instrument will easily and readily follow the pathway of the previous shapers, and just shy of length, the instrument is immediately withdrawn as the final shape has been carved. There are 3 ProTaper finishing files, and their D0 diameters are 20, 25, and 30. As such, following their use, the foramen must be gauged using correspondingly sized 20, 25, and 30 hand files. Following the use of Finisher 1, the foramen needs to be gauged to ascertain if it's truly a 20 or larger. A 20 hand file is carried to length. If the 20 hand file is snug at length, the case is ready to pack. In the event the 20 file is loose at length, proceed to Finisher number 2. Finisher number 2 is a 25 at D0 and it has an 8% taper. Following its use, gauge the foramen with a 25 hand file. If the hand file is snug at length, the case is ready to pack. If the hand file is loose, proceed immediately to Finisher 3. Finisher 3 is a 30 at D0 and has a 9% taper. And, following its use, we again gauge the foramen using a 30 hand file. If the 30 hand file is snug at length, we're ready to pack. In the event the 30 hand file is loose, there are a variety of techniques that we'll talk about shortly that can finish the apical 1/3. Currently, I'm using microbrushes to optimally finish the root canal preparation. Microbrushes can be selected, activated, and used in a rotary handpiece. A high magnification demonstrates how the bristles are attached and shows the helical angle that augers debris out of the canal. Finishing an irrigant-filled shape canal with a microbrush has been shown to significantly enhance the cleanliness of the preparation. Tapered microbrushes enhance cleaning as bristles deform into the irregularities of the preparation and move debris into solution where it can be liberated from the root canal space. The clinician must make a decision whether to finish the apical 1/3 manually or with nickel titanium rotary shaping files. How we do this is we check for the glide path. As we spoke about earlier, when the 15 file is snug and at length, we lift it up and without reciprocating the handle, we push it directly back to the radiographic terminus. Then we pick it up 2 millimeters and 3 and 4 and 5 millimeters, and in general, if the instrument cannot be slid to length because it hangs up on a bifidity or a canal anomaly, then we should consider manual finishing. We pre-curve 10 and 15 hand files. We exaggerate the curve, we use unidirectional stops, and we work the instrument past the bifidity. When the instrument is at length, we work it gently and repeatedly in vertical amplitude strokes. Gauging and tuning with ISO O2 tapered hand instruments is a technique directed towards confirming a uniform taper in the apical 1/3 of the root canal preparation. The clinician begins to gauge the most apical cross-sectional diameter of the canal when a hand or rotary instrument just snugs into the terminus and resists further apical travel. In order to prove with certainty that the diameter of the file at length represents the true size of the foramen, the clinician must then tune. Tuning is the clinical activity of recapitulating through a series of successively larger instruments and working them until they are observed to uniformly back out of the canal. The interval of backout between successively larger files should not be greater than 1/2 millimeter. The file that snugs in at length only represents the true most apical cross-sectional diameter of the canal if each progressively larger instrument uniformly backs out of the canal in 1/2 millimeter intervals. Gauging and tuning verify deep shape and are an opening for cone fit and packing in 3 dimensions. In summary, if the 20 file represents the instrument that was snug at length, then every successively larger instrument moves progressively short of the radiographic terminus. Following gauging and tuning procedures, one can simply look at a series of instruments and note the position of the rubber stops. Generally speaking, when you have deep shape, you can see a progressively larger gap between the top of the stop and the plastic hub on the handle. In this maxillary first molar, the mesial buccal root in its apical 1/3 is quite complex. This is an example where manual finishing procedures are indicated. Again, in a mandibular second molar, you can see that the distal root has trifidity in its apical 1/3. Whenever the canal makes a sudden change in cross-sectional diameter, this would be an indication where rotary instruments may separate. This is a maxillary first molar. Notice the calcification in the pulp chamber, and then be aware of the stones that appear to be projecting into the root canal system. Specifically, if we look at the MB root, we can see it's multiplanar. There's a curvature in the coronal 1/3, there's a distinctly different curvature in the middle 1/3, and there appears to be recurvature in the apical 1/3. Following complete access, a 10 hand file gives us information regarding cross-sectional diameter. We can observe the handle to see if it's on or off the long axis, and we can begin to determine if we have complex or straightforward anatomy. The 15 follows the 10. Another 5 to 6 cutting cycles refines the glide path, carries more irrigant deeper into the anatomy, and paves the way for rotary shaping files. Shaper number 1 follows the use of the Scouter files and can be introduced whenever we have a smooth and reproducible glide path. Let the instrument float down, and when the rubber stop is just short of the reference point, the instrument is withdrawn. We can observe the debris on the flutes, and it can tell us quite a bit about where the instrument's actually cutting in the canal. Following Shaper 1, we can use either Shaper X or Shaper 2. In this instance, I will use Shaper 2 with the white identification ring, since the handles of the 10 and 15 files were on axes. Let the instrument float into the canal. I like to use the pencil lead analogy. Push no harder than you are writing with a pencil without breaking the lead. When we've achieved the level of where Shaper 1 went, the instrument is immediately withdrawn. Irrigate and recapitulate and re-irrigate. The 10 file is easily passed through the pre-enlarged canal. A pre-enlarged canal will generally allow the 10 file to slide to length. Once we're at length, stay at length, and carefully and repeatedly explore and refine the glide path. When we have a smooth and reproducible glide path, patency is established. Check the glide path by taking progressively longer strokes. The pre-curve 15 file follows the use of the 10. Its handle is gently reciprocated in a back and forth watch winding motion. This will typically pull it into the canal so it can achieve length. In a pre-enlarged canal, we've made a more direct path to the terminus, so at this point we should be thinking about checking our working length. After confirming working length, it's time to irrigate and fill the chamber brim full with sodium hypochlorite. The tin file is passed through the canal and we maintain patency. Little short amplitude strokes ensure patency, and progressively longer strokes confirm the glide path. We're now ready for the use of shaper number 1. This instrument has a purple identification ring on its handle. The instrument is carried into the canal, and generally it can achieve length quite easily. Sometimes we'll lift the instrument up just a little bit to allow debris to more effectively auger up its cutting blades. Once we've achieved length, the instrument is withdrawn. Following the use of shaper 1, we irrigate, recapitulate, and re-irrigate. This gives us confidence to proceed with shaper number 2. Shaper number 2 will generally follow the glide path and achieve length on its first pass. When we're at length, the instrument is immediately withdrawn as the shape has been cut. Again, we'll irrigate and recapitulate and re-irrigate. The tin file is gently placed to length. Patency is again maintained. Little short amplitude strokes assure the glide path and pave the way for the 15. At this stage of treatment, the 15 file will readily drop to length. When it's at length, it's wise to reconfirm working length, and I use the electronic apex locator. The lead lassos the shank of the file, and the reciprocating handle motion is gentle, and we just minutely move the file away from the terminus. Then the file is slid back to length. If we get a stable reading on the display unit of our electronic apex locator, we have confidence of working length and we can proceed on. Now we reconfirm the glide path, and this is accomplished by taking progressively longer strokes. When we have a smooth and reproducible glide path, we're ready to proceed to finisher number 1, which has the yellow identification ring on its handle. This instrument is allowed to move easily into the canal and floated to length. Generally, it will achieve length on the first pass. When we've achieved length, the instrument is immediately withdrawn. Now we can irrigate, recapitulate, and re-irrigate. Following the use of finisher 1, which was a 20 at D0 and has a 7% taper, it's time to gauge. Gauging is accomplished by using an ISO 02 tapered 20 hand file. If the 20 hand file is snug at length, we're ready to pack. For first-time ProTaper users, it's important to appreciate the kind of shape that was just cut, and we can do this by using a series of ISO 02 tapered hand files. Tuning is the clinical exercise where each sequentially larger instrument is placed into the canal. When the handle is snug, the rubber stop is pushed down on the reference point. Recall the 35 through 60 hand files are nickel titanium. These highly flexible instruments will be easily inserted into the canal. When the handle is just snug, the assistant pushes down the rubber stop, and we can begin to see more gap between the top of the stop and the plastic handle. This again reassures us that each larger instrument is moving further and further away from the terminus. To confirm deep shape, we proceed on through the series of hand files. Deep shape is confirmed when each larger sequential instrument is observed to progressively and uniformly back out of the canal. Deep shape creates a more effective reservoir of irrigant and provides the resistance form to hold gutta percha during three-dimensional obturation. The 60 is the last instrument used. The 60 will usually be within about 3, 4, or 5 millimeters of length. A quick way to check your shape is to have the assistants show you the rubber stops and look at the relationship from one stop to the other. Following the use of the 10 and 15 hand files in the coronal 2/3 of the MB2, and after shaper number 1 has expanded the glide path in this region of the canal, we need to make a decision between shaper 2 or shaper X. When the handles of the 10 and the 15 hand files are off axis, then select shaper X because it can be used like a brush to move the coronal aspect of the canal away from focal danger. Shaper X is passively fed into the canal until it encounters light resistance. then withdrawn 1 to 2 millimeters so it is loose within the canal and used to cut dentin on the outstroke. Shaper X is used like a brush to expand the shape and to improve straight line radicular access. When the desired shape has been achieved in the more coronal portion of the expanding preparation, then Shaper X may be passively fed a little deeper into the canal until it again encounters light resistance. To clear the debris off the blades, the assistant steadies the hand and plunges the sponge to clear the blades. Shaper X generates an enormous amount of debris, so it's important to irrigate, recapitulate, and re-irrigate. As we've used Shaper 1 and Shaper X, then the optimal shape has been cut in the upper 2/3 of the root canal space. Now we can scout the rest of the canal. Again, a small tin hand file is carried into the canal, worked up and down in both systems because the systems may in fact be common in their apical 1/3. The 15 file follows, and again it's moved up and down in short amplitude strokes to move debris into solution so it can be effectively liberated from the root canal space. With a smooth reproducible glide path, we can now use Shaper 1 to length. Shaper 1 is carried into the canal and will work primarily at the junction of the middle and the apical 1/3. Shaper 2 now can be carried to working length, and it's again allowed to move into the canal, and the shape can usually be cut in one single pass. Following the use of Shaper 1 and Shaper 2 to length, it's time to irrigate and recapitulate and re-irrigate. The tin hand file stirs the solution and moves debris into suspension where it can be subsequently liberated from the root canal space. The 15 file follows the tin and assures us that Rotary can follow. It's important to confirm working length at this time because, again, remember that a shorter, more direct path to the terminus exists. Finisher number 1 is the instrument of choice and follows the use of Shaper 2. Finisher 1 is carried into the canal, it's allowed to move just short of length, and then it's immediately withdrawn. This instrument will load up quite a bit of debris and auger that debris out on its cutting blades. Following the use of the Finisher 1, we gauge the size of the framing with a 20 hand file. We tap on its handle to make sure that we can't displace the file periapically. If the file is snug at length, we're ready to finish. A 17% solution of EDTA is flooded into the tooth, and we use a rotary brush to activate this solution. The bristles collapse into the irregularities of the canal and more effectively remove the smear layer so we can get a tighter pack during three-dimensional obturation. Now that we have completed the canal preparation, let's quickly review the ProTaper sequence. In the clinical op, the sequence of instruments used in both the MB1 and MB2 was exactly the same, except when we shaped the coronal 2/3. In the MB1, when the handles of the 10 and 15 files were on axes, we used Shaper 1, then Shaper 2. In the MB2, when the handles of the 10 and 15 files were off axes, we used Shaper 1, then Shaper X. Appreciate that Shaper X may be used in the on-axis sequence to provide more shape as desired.